Hello, my name is Lisa Garlington, and today I'm going to be instructing second year nursing students who are age 18 or older, and they are in an associate degree nursing program. And this lecture will be based on curriculum from their obstetrics and gynecology curriculum. So we're going to be talking about iron deficient anemia in pregnancy. And our agendas for today, our learning objectives are going to be to apply the information from this lecture to patient scenarios, like case studies, to determine the clinical indications and necessary nursing actions for iron deficient anemia by the end of this class. We might also refer to it as IDA. Another objective is identify normal and abnormal lab values by the end of this lecture through written evaluation used to diagnose IDA. And then recount adverse outcomes and potential risk factors of IDA and integrate them into patient care plan to be completed individually after the lecture and turning that in next class period. Let's start off with defining the disease, iron deficient anemia. It's a decreased iron content in the body resulting in reduced amounts of oxygenated red blood cells leading to tissue hypoxia. And then, so what this means on a cellular level is iron is consumed through food and absorbed across the basolateral membrane via ferroprotein, where it binds to plasma cells and is transported throughout the body. Iron levels are mainly regulated by hepatic peptide, hepcidin, and abnormal hepcidin levels contribute to dysfunctional iron metabolism. Some of the risk factors that we're going to look at are low dietary intake, which is not usually common in the United States because we get plenty of protein from our food from beef and other meat sources, as well as like your really green leafy vegetables. Malabsorption, this could be caused from gastric surgeries, anything like that that might be disrupting absorption in the gut. Excessive demand, infancy or pregnancy. So what we're talking about is IDA in pregnancy, so that is definitely a risk factor. And then chronic blood loss, and this could be from having like chronic hemorrhoids or peptic ulcers, that sort of thing. Adverse reactions, just to name a few, we have several here. In pregnancy, premature rupture of membranes, fetal growth restriction, fetal hypoxia, premature birth, increased risk of cesarean section, preeclampsia, impaired wound healing, and postpartum infection. So as you can see, it's not a very complicated disease process, but it does have a lot of adverse reactions. Next, we are going to look at symptoms. Your pregnant moms might present with extreme fatigue, weakness, pale skin, shortness of breath, chest pain, or palpitations. The gold standard for diagnostic testing is going to be a complete blood count, serum iron levels, ferritin, and transferrin. These are all things that will contribute to diagnosing IDA. Some treatment options, diet modification, of course, which would be the most easy, would be incorporating some more iron-rich foods into your diet. Again, that protein and the green leafy vegetables. And then really the go-to for treatment options is typically your ferrous sulfate orally, which is 325 milligrams given once a day. But sometimes you have moms that can't tolerate oral medications, or this upsets their stomach too much, or they have difficulty swallowing pills, so they may not be compliant with taking the oral medication. So then another option might be IV therapy, where the mom would come to get infusions. It could be once or twice, or it could be over several weeks that they would come for this type of treatment. Here's some lab values that we would compare. The normal range for hemoglobin, hematocrit, iron, ferritin, transferrin, and MCV, which would look at the size of the red blood cells. And if they're smaller than normal, then that is a good indication of iron deficient anemia. All of these levels will increase, or I'm sorry, all of these levels will decrease for this diagnosis, except for the transferrin. That one would increase. And then we have some differential diagnoses. The first is anemia of chronic disease. The pertinent positives include low serum level in iron, normal to low transferrin, and elevated erythrocyte sedimentation rate. So those are going to be similar to your IDA. But some of the things that set it apart are it's typically diagnosed in an older population, and it's associated with other chronic conditions. Next, we have chronic blood loss. That pertinent positive includes fatigue, weakness, pale skin, chest pain, and headache. All those you can see with IDA. But then something that would set it apart with the pertinent negatives is symptoms over a longer period of time, because it's chronic, and then the dark fouling or foul smelling stool, meaning that something's been going on in the intestines for a longer period of time that would affect the stool. And then lastly, we have hereditary hemochromatosis. Pertinent positives for it include fatigue, weight loss, abdominal pain, and then pertinent negatives are it will affect a woman's menstrual cycle, so she might have amenorrhea from that. There could also be loss of body hair and loss of sex drive, which these aren't typical symptoms that you would see whenever we're looking at iron deficient anemia. And at this end of the class, we would have to go over a short quiz to kind of cover the lab values that we had and some of the diagnoses, and then we would also hand out a care plan for everyone to complete over iron deficient anemia, and that would be returned by the next class period. So I hope you have learned something today about iron deficient anemia. Thank you very much for your time. Good night.